possible.
On some of the pictures we have, and they're displayed now, maybe you can just explain to us what that is for the benefit of those who may be watching.
The photo that was there right before that is a unilateral cleft lip and palate. As you can see, it was going all the way in. These photos are showing how you feed a cleft palate patient.
Okay.
Like I said, many patients are coming to us malnourished. They have not been feeding well because it's difficult to feed the patient and they're not able to take as much. There's a position that you're supposed to put the baby. They're supposed to feed seated, not lying down like normal
would
babies.
this be the correct position, the one that was displayed?
No, that would not be the correct position. The correct position would be the baby propped up, and then you have to express the milk into the mouth of the baby. Many of them are not able to create that vacuum to pull out the milk, and you have to take a cup and a spoon, express your milk into a cup and spoon, and feed the baby with a cup and spoon.
Okay. We also have another picture there that looks like almost a combination of cleft lip and palate.
And bilateral, it's both sides.
Wow.
Yes.
So this would be, there would be a hole coming right from the nose going down to the throat?
Right from out here all the way to the throat. It's completely open.
Isn't that potentially a sea for bacteria to breed and bring about other infections?
Yes. Cleft lip and palate patients have a lot of complications. One of them is recurrent infections, chest infections, throat infections. Like you said, it's an open airway that is not supposed to be open. So there's a lot of bacteria going in, and they come with infections. And that's why we want to treat them as early as possible to avoid these complications. They have problems with speaking because when it's for you to have normal speech, your roof needs to be complete. When it's open, you have them speaking and you can't understand what they're saying.
Okay.
Yes.
We also have another picture there. Is that now the correct way of breastfeeding, or is that still wrong? Because you mentioned they need to be upright.
Yes, they need to be upright. What they're showing there is that when the baby is feeding, there's a lot of air that is going into the stomach. And for many of them, the baby will fall asleep. You assume the baby is full, but it's because they got tired of suckling and they are full of air. So you have to keep burping the baby, keep putting the baby to your shoulder and rubbing their back so that the air can come out. It's a tedious process, but the good news is that it will be repaired. It can be repaired.
Okay, we can see there, is that now milk going to the lungs?
Yes. It is possible for the milk to go into the lungs and get an infection.
Through the airwaves?
Through the open, you see, your lungs are through the nose. The communication is through the nose. When it's open, the milk can go into the airway instead of going into the stomach and can get into the lungs and get an infection.
What are some of the dangers you'd have when now the milk goes to the lungs? Because that sounds quite dangerous.
The worst danger is that a patient could die. It's estimated that 1 in 10 cleft palate patients die before the age of 1 year. And that is the most devastating of the dangers. The others are having recurrent pneumonias and having recurrent chest infections. Okay,
so just a quick reminder to mothers that now is this the quick...
That is the correct position.
Okay.
With the baby seated up, so that they are taking less air into the stomach, and they are also, it's easier for them to get the milk into the mouth. Okay,
and you mentioned that they're not able to suckle, to create that vacuum to pump. How does one overcome that?
One of the ways to overcome that is to help the baby by the mother pressing her breast when,
we have another position
feeding.
There.
Yes, when feeding, so you press so that the milk is coming out faster than a normal baby would suckle out. The other alternative is to express the milk and use a cup and spoon to feed. The other alternative is to use a feeding bottle, but we discourage that because of the risk of developing diarrhea. And we ask that if you're going to use a bottle, it has to be properly sterilized. It has to be boiled for about 10 minutes for it to be properly clean. But because we know most of these patients are coming from a very poor background, we completely discourage the use of feeding bottles, and we ask you use a cup and spoon.